To everyone. My name is Huang Wei Ling. I'm a medical doctor from Brazil. I'm very happy to be here today to share two studies in this neurology webinar. I would like to thank the organizing committee to inviting me to this conference. To share this first study is entitled, "Is there any correlation between the ingestion of some kinds of foods and headache?" According to Western medicine, headache is not a symptom, but a disease in its own right. And headache is a common presentation in primary care. It affects patients' work, relationships, and social activities.
Maura, we can no longer hear you. I think that you turned your microphone off.
Yeah. Now can you hear me?
Yes, we can. All good now.
Okay.
Thank you.
You're very welcome. Oh, I will begin again. Okay, according to Western medicine, headache is not a symptom, but a disease in its own right. Headache is a common presentation in primary care. It affects patients' work, relationships, and social activities, and exacts significant social and financial cost. While headaches make up 5% of the global disease burden in terms of disability, the Singapore lifetime prevalence of headache has been reported to be 82%, and that of migraine 9%. According to data from the Brazilian Headache Society, 13 million Brazilians have headaches daily, a number higher than the found in the other countries, such as in the United States, for example. This is an alarming fact. People usually take painkillers, increase doses, then change the types, ask for tips for friends, relatives, and pharmacy clerks on more powerful painkillers. And when they get to the specialist, the pain is already daily, and the lists of painkillers that no longer resolve is long. This happens for several reasons, and difficulty in finding a specialist for its correct diagnosis and treatment, trivialization of pain, and belief in self-medication. Overuse of analgesic medications is now the main cause of chronic migraine. And according to Jerome et al. In an article entitled "Association of Diet and Headache Among Lifestyle Modalities," nutraceuticals and diet play a notable role in headache, migraine, and therefore adjusting one's diet could be useful in preventing and treating headaches. And the main components of the comprehensive diet including carbohydrates, proteins, fats, vitamins, and ions. It's not clear whether these dietary factors prevent or provoke headache attacks. And the initiation of the headache attack may occur following consumption of specific food items. And these food items should be identified and eliminated. Moreover, making a specific dietary recommendation based on patients' needs and types of comorbidities could be effective in reducing the frequency of headache or even preventing initiation of an attack. As I end of talk, the Western medicine is already using the diet to treat headache, but they usually focus on lose weight or take out the foods to try by trial and error. Thus, I followed what Hippocrates said, that foolish the doctor who despised the knowledge acquired by the ancients and the use of traditional Chinese medicine to treat my patients, and not the symptoms, but the whole body. That's why in this presentation, I will use some concepts in TCM to explain if the food could induce or not the headache symptoms. I like to use the metaphor of this tree to explain my reasoning. The patient seeks the doctor due to headache, which in the metaphor of this tree, I am showing that this tree represents the human body, and this tree has a trunk with several branches. Each branch represents one medical specialty, and coming out of each branch, you can see many leaves, and the leaves represents the symptoms and disease treated by each specialty. And in this presentation, headache or migraine can is considered a leaf in the neurology branch, and Western medicine treats the leaves. And in this presentation, I will address what could be happening in the root of this tree, leading to the manifestation of headaches, and including the influence of the external pathogenic factors that Western medicine does not usually address in their reasoning. But according to TCM, they are important factors for inducing the formation of a variety of disease, not only headaches, but the majority of the disease. And in this root, you can see that there are, they are usually not seen by the naked eye because they are under the earth. And there are two theories here under the earth that are the 5 elements, and the yin and yang theory that I will explain the next slides. At the root, as I show you, there is 2 theories, the yin and yang theory and the 5 elements, and also the external pathogenic factors and the emotions, and also the dietary that can influence the health of this tree, and the leading or not due to many disease manifestations, in this case, the induce of headache symptoms. According to traditional Chinese medicine, there are 12 main meridians in the human body, and all pass through the limbs. On the ventral surface of the upper limbs, there are 3 yin meridians from the lung, pericardium, and heart. And there are 3 yang meridians on the dorsal face that are large intestine, sanjiao, and small intestine. In the lower limbs, there are 3 yin meridians that are spleen, pancreas, liver, and kidney, which pass throughout the median phase, and the 3 yang meridians that are stomach, gallbladder, and bladder that pass through the anterior, lateral, and posterior surface, respectively. All yang meridians comes to the head, as you can see in this slide that I am showing you that, for example, the stomach, they pass through this channel, the large intestine to this channel, and here is the gallbladder meridian, very common. There is manifestation in this part of the head. In this part, it is very common. You see patients complaining pain, this part. And the sanjiao is when the pain in this part, in small intestine, in this part, and bladder is when the patient has pain, this part of the body, of the head. And in the top of the head, there is not a figure here. I'm demonstrating that it's the liver energy meridian that pass through here in the top of the head. And when the patient complains headache in the top, this means that the problem is in the liver meridian, in the energy point of view. And to demonstrate this presentation, I will show you one case report. that I treated myself in my clinic in Brazil. She is a 32-year-old female patient that had a background of 16 since 16 years old. She started having pain on the stomach and burning sensation, as well as strong headaches. She was diagnosed with reflux through an endoscopy, and treatment was started using lansoprazole and pantoprazole and diet for reflux. And she performed this treatment for 4 years with no improvement. And she performed surgery for reflux, maintaining the diet. She lost 17 kilos in a month, had anemia and lack of vitamin D. And she suffered with these symptoms for several years, having performed more than 8 endoscopies, which would reveal gastritis, even though she did not respond well to the medications. She then searched for treatment with ancient medical tools, and she went to my clinic to treat by Chinese medicine, and her diagnosis in the first appointment was yin, yang, qi, and blood deficiencies. Due to she had here yin, she had hot flashes, she had cold feet, and abnormal sweating during the day in whole body, and she had no daily bowel movement characterizing blood deficiency. And also she had heat retention, because these all are energy alterations in the energy level. And she had heat retention because she had the dry mouth and bad breath. And the patient also, I did the measurement of her internal energy doing radiesthesia procedure. And what I found that this patient was in the lowest level of energy in any of her chakras energy. And this chakra means energy points that regulate all the functions of all cells, organs, and systems inside the body. And she only had the energy in the 7th chakra, that was the spiritual chakra. The first chakra, there is a correlation between the chakra and the 5-element theory in some studies in the literature. And what I'm doing nowadays is measuring the energy of the chakra. And in each measurement, I can know the energy of one internal massive organ in traditional Chinese medicine. Why I'm measuring these energies? Because each organ is responsible for the production of the energy, responsible for the functioning of diverse organs and systems, and each organ is responsible for the functioning of one external sensorial organ, such as the first chakra is the liver, and liver is responsible for the eye and vision. The kidney, our second chakra, is responsible for the ears and the hearing process. The heart is responsible for the tongue and communication. The lung is responsible for the nose and sense of smell. The spleen is responsible for the mouth and sense of taste. And all these, you can see that these are 2 elements very common. All these patients nowadays that are having COVID-19, they are having this kind of pattern, because they don't have energy in any of organs inside the chakras. And the manifestation of lack of sense of taste and the smell is due to this lack of energy inside these massive organs. And in her case of this patient, what I did was to find the problem, and I treated her, replenishing these energies. The first thing was the Chinese Dietary Counseling. Orientate her to avoid all dairy products, all raw food, all sweets and cold water, because these foods could induce the spleen and pancreas deficiencies that is responsible for the absorption of nutrients. And this is the entrance of the energy inside the body. And when this spleen is not working, it represented by the fifth chakra that you saw, they do not have energy to work. All the foods that this patient was consuming was not absorbing to form blood. And that's why all the organs were in the lowest level of energy. And the second group of the diet was to avoid coffee, soda, mate, tea, because all these drinks could induce the kidney energy deficiency that's responsible for the production of yin-yang energy. And the third groups of diet is to avoid these fried foods, egg, chocolate, honey, coconut, alcoholic beverages, melted cheese, and all dairy products, because all these dairy products, all these foods could induce the energy imbalances in the gallbladder and liver that could be causing the manifestation in the stomach and in the head, leading to headache symptoms. And that's why I used the auricular acupuncture as a Chinese tool to regulate the internal energies. And what I put was to put the anxiety point here. Number 1 and 3 is for anxiety. Number 2 is to to lead her to sleep well. And because it is in the sleeping process that the patient could acquire energy to replenish this energy through sleeping. And the other points, the kidney, liver, spleen, lung, heart, all these points are to regulate the yin and yang blood production. And also I used the apex ear bloodletting to take out the internal heat that was causing some manifestation of headaches and her symptoms, because the patients, when they have deficiencies in energies, they could produce this internal heat that's the second energy imbalances, and these could induce some headache symptoms also. And here are some points that I usually put in patients with headache that is not here, but the pain points to treat headache are in this side of the ear lobule to treat the symptoms of headache. And also the medication that I usually use to treat this lack of energies, I use homeopathy medication that are high diluted medication instead of high concentrated medication. I will tell you why I'm using this kind of medication, because in Brazil, in China, they usually use Chinese herbs to treat these alterations in the internal organs, energies. But in Brazil, I have some difficulties to find this kind of medication. We have Chinese herbs, but we do not have a regulation to prescribe this kind of medications. And that is why in 2015, I started to study homeopathy. And I created this theory entitled Constitutional Homeopathy of the 5 Elements based on traditional Chinese medicine. And using this theory, and nowadays I can treat my patients using homeopathy medications, but using traditional Chinese medicine reasoning, treating all these kind of lack of energy. And this theory can be used in all kinds of treatment nowadays, not in patients with headache, but patients with any kinds of disease needs to be treated in the root of this tree using this kind of medications. Because in a research that I did in my clinic from 2015 to 2020, I showed that the majority, more than 90% of my patients were in the lowest level of energy. They don't have energy in any of the massive organs. And this could be caused by the electromagnetic waves that are in the whole world nowadays. And that is why I think this lack of energy is not only in my patients in Brazil, but I think in the whole world. And all the patients, I think nowadays, they are in the lowest level of energies, leading to diverse manifestation of the disease, such as depression, anxiety, panic syndrome, and all the Western medical diagnoses such as diabetes, hypertension, myocardial infarction, cancer, and all chronic disease are related to this lack of energy nowadays. And using this kind of dietary counseling and nutrition and doing all these tools, the patient recovered very well, and she did not have any headaches using this kind of treatment, and replenish her chakras with this high diluted medication. And all the medications that she was using to reduce the gastric symptoms, such as omeprazole and all the antibiotics and all the high concentrated medication, we withdrawn because as this medication could harm even more her vital energy, that I will show you in my next slide. And all this treatment was based on one patient that I treated myself in 2006. And I will tell you his history briefly. He was a 70-year-old male patient that was reporting pain in the legs, and his Chinese diagnosis was kidney iron deficiency, and he was treated with the same type of treatment using Chinese dietary counseling, acupuncture, auricular acupuncture with apex ear bloodletting. And with this treatment, he improved in his leg pain, but also he told me that he for the first time of his life, he said that he was treating glaucoma for the last 40 years with no improvement with the use of eye drops. Using this kind of treatment, for the first time of his life, his intraocular pressure reduced from 40 to 17 mmHg. And after this treatment, I began to do a research in Brazil in São Paulo University in the glaucoma department in ophthalmology department in the University of São Paulo, try to comprehend why the treatment treating the root of the energy imbalances can treat all patients' disease at the same time, in this case, reducing the intraocular pressure in glaucoma patients. And here's to show you that yin and yang are the theory that is based all the traditional Chinese medicine treatments, and the aim of this treatment is to balance this yin and yang in the same height, and the imbalance of these energies will lead to diverse manifestation in the patients. And when the patient has these energy imbalances, the aim is to balance again this energy to achieve health. And the second, and this graph is to show you that to yin and yang to flow adequately inside the meridians, there is the necessity of having qi and blood inside the vessels, and there is the necessity of having these four energies in harmony to achieve health in all patients. And yin and yang are two energies that produce in the kidney or in the second chakra. Kidney is the energy that's produced when yin and yang and blood are in the adequate level inside the body, and the qi will normally be adequate. But if there are some energy deficiencies or combination of these deficiencies, could affect the qi, and the qi is controlled by the liver and the lung, that is the first and the fourth chakra, and the blood is produced by the fifth chakra and is regulated by the functioning of the heart meridian. And here is to show you that when there are energy deficiencies inside the body of the patient, or a combination of these four energy deficiencies, there is a formation of internal heat in TCM that could be the one of the manifestation. This heat in the gallbladder that could induce the headache symptoms in the region near the eye. And here is the question that I usually do in the first appointment of my patients, to see if the energy are balanced or are in the imbalanced state. For example, to see if the patient has blood deficiency, you ask the patient if he have daily bowel movement. If not, he could have blood deficiency. Indeficiency is very common in women in menopause, when the patient feels hot, mainly in the extremities. Qi deficiency is when the patient have excessive sweating during the day. Yang deficiency is when the patient feels cold, mainly in the extremities. And heat retention is when the patient has dry mouth, bad breath, bleeding gums, acne, and or redness in the skin, abdominal pain, microhematuria, or itching in the body. And here's to show you the second theory in TCM, that all internal organs are interrelated by the energy flow. One element depends on the energy of the following element to have energy to work properly, and one element can control the functioning of the other element. This theory is very different from the Western medicine perspective, when all the internal organs are working separately and they don't depend on the energy of the other. And for example, the manifestation of dyspnea symptoms, for example, in patients nowadays with COVID-19, here in Western medicine, they understand that the problems are in the lung, but in traditional Chinese medicine, this dyspnea could be related to energy deficiency in other organs, leading to manifestation in the lungs. This is the same, I will not repeat. And the medication that I demonstrate to you needs to be in the sequence of the generation cycle. Heart sends the energy to the spleen to the lung to the kidney to the liver, and liver to the heart. And according to Hippocrates, make your food your medicine, and your medicine your food. That's why in all treatments, the first step that I usually do is to do the Chinese dietary counseling. Why Chinese dietary counseling? Because the Chinese dietary counseling uses the according to energy imbalances of each patient, we will indicate which kind of foods that the patient needs to eat according to energy imbalances of each patient, because each food has their own energy state, and depends on the kind of food, on the type of how you are preparing this food, if you are eating raw or cooking, or you are doing some kind of how you are preparing this food, the energy of this food will change, and you need to prepare this food according to the energy imbalances of each patient to treat these energies imbalances. And in the patients with headaches, the main kind of food that you need to take out is the dairy products and all the cow's milk, because this is the main source of the foods nowadays that is affecting the liver, that is the most organ responsible for the headaches manifestations nowadays, that it can affect the top and this area of the face, because here is the gallbladder meridian, but the gallbladder is a hollow organ that's acoplated to the liver, that is affected when you have some kind of manifestation disease in the liver. You can have after the disease in the gallbladder too, and leading to the manifestation of headaches symptom here. And the foods that can lead to liver and gallbladder liver imbalances are these foods that I showed you: fried foods, chocolate, egg, honey, coconut, alcoholic beverages, melted cheese. And these are the foods that you need to orientate the patient to avoid, to take out, because if the patient continue to ingest this kind of foods and avoiding all dairy products also, such as pudding, ice creams, yogurt, and all kinds of cakes that has dairy products, the patient will maintain the headache, and he will need to ingest the medication, painkillers, but the factors that is causing the headaches is the ingestion of these kinds of wrong foods. And milk causes spleen pancreas deficiencies, causing difficulty in absorbing nutrients, anemia, premature aging, and other problems. The other types of milk can be ingested by the patient, such as soy milk and other kinds of milk. And not the only milk that the patient should be avoid is called milk. And when the patient is ingesting soy milk, there is a follow-up of exam, because this soy milk could induce the hypothyroidism. I think it's because of this kind of soy that they are using nowadays that's transgenic. And the other recommendation could be the patient could ingest goat milk, or this yams milk is very good, this kind of milk, mainly for the women's patients, because yams can increase the production of blood. That woman has the menses periods every month, and she usually has the blood deficiencies, and this kind of milk is very good for this kind of women's patients. And the stomach meridians, when the patient has pain, this kind of here in this region of the face is normally because of stomach meridian, but this is very common. The patient complain of pain in this part of the face when they don't have adequately time to eat the meals. For example, they usually eat one day in the lunch, for example, at 11, and another day at 3 p.m. They don't usually have a good, very right time to eat the meals, and that's why the stomach meridian can imbalance, leading to manifestation of headache in this part of the head. And the bladder meridian is when the patient has headache in this part of the occipital, and that's why the bladder could be induced imbalance by the coffee, soda, and matcha tea. You need to orientate the patient to avoid this kind of medication drinks. Oh, sorry. And here's to show you that all the foods that contain dairy products should be avoided, and not only the cow's milk itself. And for example, if the patient has yang deficiency like this, there is an energy imbalances. Yang deficiency is when the patient feels colder in the feet. And because yang energy is responsible for warm the body. And when the patient has this deficiency, he has more propensity to feel colder. And every food that is raw, such as fruits and vegetables, and water. They have cold energy when the patient eats raw, and that's why you need to orientate the patient to cook or baked all these vegetables and fruits to neutralize these cold energies and to improve this young energy. And if the patient continue to use this kind of raw food and raw drink, fruits and vegetables, he will worse these young energies and could induce in this kind of things the manifestation of headache also. And here's to show you that acupuncture is a very important tool to regulate the internal energy and treat all these patients, only regulating the internal energy to don't need to prescribe some medication, because the use of this medication are causing energy deficiencies in these patients. Because here is to show you one publication that I wrote, Acupuncture and Chinese Dietary Therapy in the treatment of patients with chronic headaches. In this article, I'm showing that acupuncture is very important tool to treat the patients with chronic headaches. But when the patient do not follow the Chinese dietary therapy, using this dietary counseling that I showed in this presentation, the patient will not have such a good result, because using wrong diet, you will induce energy imbalances, leading to imbalance of energies and leading to not good results in the treatment of headache. And the conclusion of this study is that you need to have the two medicines in the mind to understand better what's happening inside the body of these patients, to treat adequately the headache symptoms. And the headache is not the manifestation of problems in the head, could be some manifestations in the energy point of view, and not only in the head. And the conclusion of this study is that the ingestion of some kinds of food is correlating with the headache symptoms. And to prevent the headache symptom, it's important to understand which energy meridian is affected by the patients and which kind of food should be inducing or maintaining the patient's symptoms. According to Hippocrates, it's more important to know the person who has the disease than to know which disease the person has. In this quote, he's saying that it's very important to treat the patient and not the disease. You need to treat the root of that tree and not the leaf, because if you treat only the leaf of the tree, you will give him the medication and will imbalance the root of the tree that has energy deficiencies and imbalances and maintaining the patient's symptoms. And that is why if you treat the root that are the energy imbalances and deficiencies, all the tree, all the leaves of the tree, all the specialties will be treated at the same time. Thank you for listening. If you have any question, I will be very happy to answer it. Thank you.